So on your consultation form, we've gone through all the risks associated with it. I would always draw your client to section 8, so you always read this out, so it's called informed consent. I accept all that rare adverse outcomes such as pain, bleeding, bruising, infection, numbness, scarring and lumps may occur, and that some scars or lumps may be permanent. Are you happy to go ahead with the treatment? Once they're happy with it, they've had time to cool down about that appointment, and they know exactly what the treatment involves, then you can go ahead with it. So inside the product comes a batch number, so this will be stuck onto your consultation form. It'll tell you the date, it'll tell you where it's come from, so should any problems arise you can always let that client access the notes and they'll know that they had this product, and it tells us exactly where it come from, which is good practice. On the computer you can see different lip shapes, so when you look at those lip shapes, is there any that stands out that you particularly like?
I quite like these ones here.
So you like over enlarged, so you like an enlarged look. So ideally that's not going to happen in one session. So if we look at your lips,
she's got quite a petite face as well, hasn't she?
Yeah. So they're quite small, so at the moment the bottom one's slightly bigger than the top, so the golden ratio's right, but you want yours more turned up, don't you? So it's like curled up a little bit. So to achieve that type of look, you're talking probably about 2 to 3 sessions to get to that. So it'd be very important to explain that to your client, that you can't achieve lips like yours in one session. You know, the look that you get off 1 mil wouldn't be achievable with yourself. So it's important to set expectations with the client so they're not disappointed and they think, well, that's good, and it's good practice to do that, and all practitioners should do that initially with any consultation.
So they won't be disappointed then, will they?
No, no.
And if it works out quicker than 3 or whatever sessions, then
yeah, and they're aware of the ongoing costs as well then. So it's, everything's been explained, they know about what can happen. Obviously you train to a high standard, you train to deal with complications should they arise. Sometimes things can happen, but we need to follow them up. But with good training and proper planning before a treatment, things such as some of the posters that we've looked at, and we've looked at pictures of different complications that can happen, such as infection, lumpy lips, they should not be happening.
Should be avoidable.
Yeah, it should be avoidable, but things can happen. As long as your clients are aware of it and you've made them aware of it, then that's fine. So in the product range, there's different viscosities of products. Some are softer, some bind, some are like hydrophilic, so they bind lots of water. Some of them are quite high viscosity, so they sculpture, so they give more of a defined look. So because it's your first time, I would recommend Intraline 1. So it's softer, it's going to give more of a fuller look, but more of a natural one, and you can build up on that and get to a bigger look, which is what you're up to. That's what you want to get to, don't you, to that bigger look.